All right, everybody, welcome back. Dr. Blumenthal here in the Bethesda office with Natural Transplants, and today, special guest Laura. Laura, welcome. Awesome, we are so excited to have you. Fantastic story. I would thank you for sharing this with everybody, and if you wouldn't mind, telling everybody why you're here.
Yeah. This was definitely the final part of my journey as far as transitioning goes. I was just telling Dr. Blumenthal here. I've been doing this now for 4 years, close to 4 years, and I always knew that this was in my sights, but there had to be like a stage set, and now we are finally on that path where, okay, this is the final step. So, I've looked all over the country too. Gotta point that out, and in Europe as well, and I chose natural hair transplants, because I really did trust a lot of their work, and their doctors as well, and just all around, and just glad to be here today.
Awesome. Well, like I said, I'm honored that you chose us to sort of be part of your journey. And just to sort of clue everybody in, you had a hairline lowering procedure done how long ago?
Last September. Okay,
so almost a year. And so we're going to be putting more of a feminine hairline on it and obviously covering the scar up. So I'm going to have Ron zoom in so we can see. And the scar, like we talked about, the scar is actually relatively subtle, but you can see it. And we're going to drop the hairline, bring it down a little bit more feminizing look, and cover that scar up. And like we said, hopefully this is sort of the last part of your journey. I'm honored to be on it, and thank you so much for choosing us. And we'll draw everything out, do a little bit of shaving maybe, and then we'll check back in with you and go from there.
Awesome.
Okay? All right, see you in a little bit. We are back with Laura, and as you can see, we have drawn the line, and we're both happy with the way it looks. We'll kind of show you. It gives a much more feminine appearance. And again, it's not going to be this dramatic, where it's no hair, and a big thick line of hair like this. It's going to blend in much more, but we've come up into the corners of the temple area, but in the corners, we're going to blend it into the existing hair. It gives a nice, softer, rounder, more feminine look, and I think it's going to look great. All right, we've done a little bit of shaving, shaved the strip in the back. We got 2 Valium on board. How you feel?
Feeling pretty good,
actually. All right, good, excellent. I'm excited. We're going to head next door, start with the procedure, and we'll check in with you a little later.
All right.
Awesome, cool. We'll see you in a little bit. All right, Laura, we are finishing up. How are you feeling?
Pretty good, actually.
Doing all right? Good. Yeah, any pain or discomfort at all?
No, not at all.
Not too bad, good. You took a little snooze earlier, watched a couple movies, had a little lunch.
Yeah, it's been actually a very relaxing day.
Good.
I thought it was not going to be like that, but it definitely was.
Almost like the spa, huh? Almost,
actually,
right, yeah. Right. We have about 5 more minutes to go, just finishing up, and then we'll go over all the instructions and chat with you at the end.
Sounds good.
All right, talk to you in a little bit. All right, we are back. This is Dr. Blumenthal. We are back with Laura. Laura, you are finished for the day. Congratulations. How you feel?
Feeling pretty good.
Yeah.
This is a little numb, but I mean that's normal.
Yep.
I can already tell that this is a huge difference from obviously the previous hairline.
Yeah.
So I'm very excited about it.
Good.
It was an awesome day. The team was great.
Good.
And Dr. Blumenthal was pretty awesome as well.
Thank you.
But yeah, highly recommend it. Definitely no regrets.
Good.
Look forward to 9 months from now.
Awesome. I love it. I'm just going to zoom in just to see. I love the line on your face. I mean, it looks a little, obviously there's some swelling now. It looks a little odd with the kind of the triangles in there, but when it grows in, it will look a lot more natural. I love the curve, much more feminine look. And that looks perfect. It looks really, really nice. I'm just going to come around and look at the incision in the back. Obviously a little bit of oozing, which is normal. That'll grow in. No one will ever know it's there, but it's fantastic. I love it. Welcome to the family. Thank you so much for doing this. Like I said, I'm honored to be part of your journey. Any words of advice, or anybody kind of on the fence thinking about it or questioning it? What would you kind of recommend?
Yeah, absolutely. So I was about 2 years ago when I was looking into this. Not necessarily natural hair transplants, but just in general. They are they're definitely thorough here. And they know what they're doing. Anybody, whether you're trans or cis, and you're just trying to get that confidence boost back up, I highly recommend just get the consultation, and Dr. Blumenthal or whoever will,
Sometimes that's the hardest step, just making that first call.
Exactly.
Yeah.
I highly recommend it.
Awesome. Well, Laura, thank you so much.
Of course.
I'm honored. I can't wait. It's, we'll check in with you, like I said, at 1 month, 4 months, 9 months, and a year, and follow you along on the journey. And hopefully in a year from now, we can, show it off and see what you look like.
Absolutely.
And celebrate. Awesome. All right. Take care. We'll talk to you soon.